Good evening, everyone.
Evening.
Hello.
Hello.
I think we had requested to be able to share our screen, but I am getting that participant screen sharing is disabled. Is that something we can take a look at?
Yes, I'll add you as a co-host once the meeting gets going here. I want to give it a minute until we get most of our participants joining.
Okay, perfect. Thank you.
Just because I can't see the controls once you do that. So it just makes it a little bit easier as people join in here.
Gotcha.
And Jackie, this is Andrea Bernard. We're going to open the service, open the meeting up, the discussion, and then we're going to have Commissioner Harvett. She's going to introduce Catherine, and then she will introduce you. Okay? All right.
So this is kind of an unusual question, but am I in the middle of my screen? My camera is off. And to me, I look like I'm halfway out of the picture.
I know you see you pretty good.
Okay, great.
Huh? Yeah, you can see real good, in fact.
Well, I need to back up a little then.
No, you're fine. You're fine. You're fine. We just appreciate you all getting this all accomplished for us. We've been telling a lot of people there's a lot of different events going on tonight, so we may not have as many people, but we just thank you for the presentation, and hopefully this won't be the last one. We'll have something else that we can do to help the community. We really appreciate this so much.
It's a good opportunity for us to get word out to the community, so we appreciate the opportunity.
Okay.
Good evening, everyone.
Good
Hi.
evening, Commissioner Pat.
Thank
We
you.
also have Deanne Hennigan on, and she is representing the community as well. I'm really
That's
happy.
Very nice.
I'm
glad I could get on.
Okay. Yes.
Yeah,
Glad to have you.
I'm glad I could get on, Sister Bernard. I'm glad you reminded me too.
Yes. We're just really happy that we have this going on. It's so important to get as much information out because people have all kinds of opinions and ideas, and then they tend to have attitudes about certain things, and they're going in the wrong direction. So hopefully you'll turn us around and put us in the right perspective. So when we get on, we're going to ask people to mute their microphones, and we're going to when we open up at 6, then we'll start with me and then Commissioner Pat Harvett.
Okay.
And then you will introduce
Catherine.
Yes. Our facilitator tonight.
We'll try our best.
They're calling her MC all this time, but she's our facilitator. Presenters. You have to get the right words to choose. So much going on. But we're just glad to have all of you participating and getting this information and helping us to understand what we can and cannot do, what's available in Lenawee County as well.
Mm-hmm.
Catherine, did you have anything else that you'd like to ask beforehand, ahead of time?
I don't think so.
Okay.
I think I asked most of what I was curious about earlier.
Okay. And Michelle, you're going to see my name twice. Someone else is using my other tablet, so
Okay.
they won't be visible, but they will be using mine. Okay.
All right. Thank you.
So it looks like we have two of our commissioners on so far. 3.
And we're still waiting on a couple of our presenters, but they should be jumping on any minute.
Okay, well, we got 5 more minutes.
Right. Oh, there's Jeanette. I haven't seen Jeanette in a while. Hi, it's Sister Pat.
Hello, Sister Pat. How are you?
I'm doing well. Yeah.
Yeah, there's a lot of
Hang
people I
in
haven't
there.
seen in a while.
I know. Oh my goodness.
Yep, if you don't see them on Zoom, you won't see them.
That's so true. Yeah.
Hey, Dion, how's the sun?
It's nice. It's a little cool, but it's nice.
Cool in Arizona?
Yeah, that cool breeze came through ahead of that storm or after the storm.
Ah,
Right.
Yeah, they sent the storm to us. That's what they did.
yeah,
They
it's
did.
cold here today, windy, cold.
Yes.
It's warm today. Mhm.
Okay, Jeanette, we're glad to have you with us tonight.
Mhm.
All of you. Okay, we've got 3 of your 4 of your people now. Okay. Okay, we're doing good. We're doing good. Okay.
I had to remember the time because it's just not quite 3 o'clock here yet.
Right.
Oh, that's right. You're in a different zone.
Mhm.
So as soon as you get adjusted to Arizona, then you're gonna turn around and come back and have to get readjusted.
Yeah.
We got 3 more minutes and then we'll get started. Oh, we have a nice group. So Catherine, are all your people here now that you need on? Kathleen?
Yes, they are.
Okay. All right. And we've got, well, it's 6 o'clock my time. We'd like to open our meeting this evening, the town hall discussion. And we're so very happy to have the director and her staff from the Lenawee Community County Mental Health Authority from Adrian, Michigan. And she will be speaking along with many of her members, and our commissioner, Pat Harvette, is going to introduce her and her staff. Commissioner Pat.
Well, thank you so much, Commissioner Bernard. I am Commissioner Pat Harvat. I am a member of the Dominican Sisters here in Adrian, and it is my pleasure and delight to introduce Catherine to all of you. Earlier this week, I wrote Catherine and I said, whatever piqued your interest to pursue a career in mental health and to work with people and in that area. And she told me the story of how when she was younger, her family used to attend church on the grounds of the Kalamazoo Psychiatric Hospital. And at that time, her parents would help to assist some of the patients, you know, around at the hospital. So Catherine had an early introduction to folks who had serious mental illness and recognized the great need to be compassionate and empathetic before anything else. And she said she learned early on that we are all people, and at some time we all need some help in our lives. I think that was a beautiful story, Catherine, that you shared for your introduction. Catherine has been here as a director of the Lenawee Community Mental Health for 4 years and has worked extensively here in the area for 26 years in a variety of positions. So again, it is my delight to welcome you, Catherine, and your staff as well, to help us to navigate our way through this area and to give us the information that many of us need as we encounter so many in our lives, in our ministry, in our daily work, who may be mentally ill and need assistance. So thank you, Catherine. I turn it over to you.
Well, thank you. We really appreciate this opportunity to talk with you and so many community members. We don't often get the chance to enlighten people to the services that we offer. So I absolutely jumped on the chance. And thank you for that introduction. And it's very true. I really did have early experiences in learning how to work with a variety of people and just recognize the strengths in everybody. And I'm grateful for that. Tonight, presenting with me, I have Holly Owen. She is our Chief Operating Officer. She's going to do a broad overview of the services that we provide at Community Mental Health. Kelly Neese is here. She is our Pathways Program Manager. She will talk about Pathways Engagement Center and some of the supports that are involved, and then the prevention work that we're doing for substance use. And then Jackie Bradley is our Community Outreach and Compliance Program Director. She has the longest title, but she will talk a lot about some of the rest of the community work that we're doing that has to do with trauma and some other work. And then talk a little bit about the crisis report that we shared. Sister Pat, I think you sat on that review. So we wanted to bring that to this group too, just so you can see some of the work that we've been doing. I thought we do have a PowerPoint, so we may want to pull that up, and that'll help us stay on track in terms of time. So we won't get I can get carried away talking sometimes. So I'm counting on my staff to keep me on the right time frame here. The first thing that I thought might be helpful is to explain a little bit about Michigan's public behavioral health system. It's set up differently than it is in many other states. So it doesn't even look the same as it does in Ohio. In Michigan, about 10% of all of our Medicaid funding for the whole state is basically carved out and sent to 10 regions in the state to provide specialty behavioral health services to the most severely impacted people. So those 10 regions cover all the counties in Michigan, and the regions contract then with community mental health to provide services for, again, people who are experiencing the most severe symptoms. For folks who are experiencing more of the mild, moderate mental health issues, they typically go to the health plans or to their own commercial insurance. So somebody may be experiencing a lot of depression or anxiety, but it doesn't reach the level of CMH services. And you'll hear a little bit more about that in Holly's presentation. So those folks would get referred to their regular insurance for services. Specific to Lenawee then, a little more than 90% of our budget comes from Medicaid funding. So that's why we primarily serve people who are Medicaid eligible, because that's most of our funding. The other 10% is there to provide services for people who aren't Medicaid eligible, and then other community work and things that we do. So one thing, though, you will see in our presentation is that we do provide crisis services to anyone who's in crisis. Insurance doesn't matter. That's part of the community benefit that we provide and that we're required to do as part of our contract. So if somebody's experiencing a mental health, a substance abuse, or crisis, any crisis, they can call our crisis line 24 hours a day, 7 days a week, holidays, it doesn't matter. And we will help stabilize the crisis and then guide that person to services. And it might even be us on a short-term basis. So never hesitate to call our crisis line. That's what we're there for. And if it turns out it's not something that we normally would handle, we will know where to direct you. And our staff is really good at doing that. And they do not mind getting called at night. That's what they're there to do. And our staff is really serious about their jobs. Something that might help is when you think about community mental health and the services that we provide, think of us as a specialty service. Because we have such a small amount of funding, we really do serve a small population. So, for example, if you were to have a serious injury that required surgery, maybe a serious broken leg or something like that, you may have a surgeon involved with you and other specialty care for a time being until you reach a certain level of recovery. Then you'll be referred for maybe physical therapy, back to your primary care for monitoring. We're kind of like that surgeon and those specialty people. We serve a small population at the most critical and difficult time in their life. And most people who come through and get our services recover and go back to their primary care doctor or maybe a therapist for a period of time. They don't stay with us forever. And I think that's something that a lot of people don't understand about CMH. The other thing that we're going to talk about tonight is the work that we're doing in the community. And when Andrea and Sister Pat and I first talked, we were talking about a focus that some of you have been looking into with a group of folks in Adrian who are homeless. And how do we get them connected to services? So a really important part of the work that we do, because we don't serve a large portion of the community, the other piece that's really important to us and to our board is that we're working with our community and our community partners to figure out how to create a stronger safety net system for our community, identify gaps, look at what we can do to support partners in the community so they can provide additional services, make sure that we are understanding what people are doing so that we can adequately connect anyone that's in need of service to the organization that's providing it. And then really work together in collaboration with all of our partners to identify next steps to meet needs. And I will let our experts on the Zoom call go into a little bit more detail on that. So at this point, I'm going to hand it over to Holly to talk about CMH Specific Services.
All right, thanks, Catherine. So the population that we serve are individuals that have serious mental illness, individuals with developmental disabilities and substance use disorder, and then children with serious emotional disturbance. And then also, as Catherine has stated, that we also provide the crisis intervention, and that is regardless of if a person meets our criteria for services or have an open case, regardless of insurance. And then the next slide. And so the majority of the people that we serve at CMH are Medicaid eligible, but we also do serve the priority population, which I just mentioned, the people with serious mental illness, developmental disabilities, those that do not have Medicaid, that are are uninsured or underinsured. If they meet our criteria, we could potentially use the general fund dollars to serve those individuals. And when someone doesn't have Medicaid, we do ability to pay. So there could be, if you meet criteria, there could be a small fee for that. And then if our general fund there's a shortage with that, there may be a waiting list that person would go on to. And then anyone with insurance must use that insurance. So if there's commercial insurances, Medicaid, Medicare, then that insurance would need to be utilized. And then the next slide. Again, the crisis line, you'll probably hear us say this a few times, that is available 24/7 to anyone in the community. And there's the phone number. And then access to services. So beyond the crisis services, if someone is needing services, they call, and all of those phone calls, walk-ins, go through our access department. And then the access department, the initial step is to talk with a clinician, and we do a screening, and that screening can be done over the phone or in person. And right now, due to COVID, majority of our services are being done by phone. However, our doors are open, and we do serve walk-ins. And so then the access clinician will complete that screening, and they ask questions as far as, symptoms, history of treatment, functional impairment, to determine if at the screening level is what are those individual needs? Can they be met in the community at an outpatient provider, or do they meet our criteria or potentially meet our criteria and meet our specialty services? And then if the access clinician determines that there is a need greater than what the community can provide, then a full intake is done. And at that time, the access clinician gathers additional information. And then they'll determine if that person meets our criteria. And so then if a person is found to meet criteria, then we would open the case and then make referrals to, the case manager. Most likely it's a case manager in psychiatric services. And then as far as meeting medical necessity for our services, as Catherine mentioned, that we are a specialty service, and we do have a criteria. And so things that we look at the intake is the diagnosis of the mental illness, the developmental disability, or substance use. And then are the services that are needed beyond what the outpatient provider can provide. So if a person is needing more intense services, needing that specialty service that I'll go into after we talk about this, then that's something we look at. Or is it a matter of having some depression or anxiety that the primary care might be able to prescribe meds, or a community psychiatrist. And then we look at level of care criteria. So we do have some tools that we use to determine if a person needs our level of care. And what we look at, and then you see functional impairment. So we look at are the symptoms of the mental illness or the IDD diagnosis, are those impacting a person's ability to function? We look at the history of treatment. Has someone been, are they in and out of the psychiatric hospital? Are they have a long history of symptoms that maybe a community provider is unable to reduce the symptoms, or unable to, because of their illness, to maintain employment or maintain a household, unable to do activities of daily life, to determine. And so that's what we look at that intake and screening. And then as far as if you want to go to the next slide, this is an overview of our clinical services. And so this is these services are provided directly by LCMHA employees. So we have case managers. The case managers help with, education of the mental illness. They'll help with linking to resources. And anytime someone's case is opened up, they have an individual plan of service. So the first thing we look at is, so what are your goals? And then how are you going to achieve those goals? So the case manager then would work with the individual on, what is their resources, community resources? Do they need help with Social Security application? And then we do have a co-occurring outpatient therapist on staff. And then we have peer support services. So those are individuals who have received treatment themselves. And then we also have an OBRA coordinator. And so anyone with a diagnosis of mental illness or an IDD diagnosis, and they need nursing home services, an OBRA assessment has to be completed to determine if the nursing home placement is the most appropriate for that person. And then we do for children, we have home-based therapists, but then we also have outpatient therapists. So that's primarily done in office. And then we do have a parent support partner who has been through the CMH services with their child. And then we're responsible for 3 different waivers. There's the SED waiver, the children's waiver, and the HAB waiver. And so we are required to determine eligibility for those waivers and then assist with the application to the state. And then we monitor that. And those waivers then will provide additional support. And then we have medication services at our medication clinic, which is located at the Family Medical Center. So we have psychiatrists that complete initially the evaluation and then the ongoing medication management. And then we do have nurses on staff, and injections. We have an integrated healthcare clinician who helps with coordination of primary care and also specialty medical services. And then we do guardianship testing as well. And then anyone who has Medicaid in the state of Michigan has to be screened through CMH for inpatient hospitalization. So when they're in the ER and the ER doctors are determined that there's a potential for admission to inpatient, then they contact CMH and that the access clinician will complete that and that screening. And then we also do have the partial hospitalization, which would be the individual at the hospital during the day and then returns home. And then, as we've mentioned, we would have that provide the crisis intervention services. And then the state hospitalization are monitored through the admissions are authorized through CMH as well. And then next slide. Okay, and then we also have contracts with a number of providers in the community to provide additional services. So we do contract with an agency for the home-based therapy and also skill building services, so, and respite services, so that then would provide a break for caregivers to providing services, and supported employment, which would be used to help the individual obtain and maintain employment in the community. And then we do have community living supports, which is a staff person then helping the individual gain skills to help them live independently, go into the community, be part of the community. And then we do have contracts with providers for SUD services, residential detox, and also outpatient services. And then we do have contract with behavioral psychologists who provide behavioral planning, and then they monitor plans. They do an assessment, behavior plan, and then monitoring. And then we also do have the autism waiver that we have a contract with someone to do the ADOS assessments, so that then determines if the person has a diagnosis of autism, and then also provides, we have contract with providers that provide applied behavior analysis. So those are helping the individual increase communication, socialization skills, and then the outpatient services, which would be most likely the therapy. And next slide. I think then that will concludes my portion of the presentation, and then Kelly Neese, the Pathways Manager, will talk about the Pathways Engagement Center.
Thanks, Sally. Hi, everybody. So I am the manager for Pathways Engagement Center, and a lot of people in Lenawee County aren't really aware of what that is. And what it is a drop-in center that's open after hours, after most businesses closed, after CMH is closed. And it is ran by peer recovery coaches. And so peer recovery coaches are people or individuals that have struggled with substance use disorder and are successfully in recovery for greater than 3 years. All of the peers that work at Pathways Engagement Center are certified peer recovery coaches. And how that lends a unique point of care for people suffering with substance use disorder is that it offers a really compassionate and empathetic approach to helping people that suffer from substance use. And peers are really able to connect and reach out to those that have gone through struggles similar to theirs, because they have a lot of insight into that struggle. And so what we do there is not just treat people with substance use disorder, because it's not just that easy. People that suffer with that diagnosis often have a whole complex plate of issues that they struggle with. So a lot of times substance use will lead to housing crisis, food instability, healthcare issues, lack of insurance, all of those kind of things that you can think of that would happen to a person that is kind of out of control in their life. And so what the peers do is help link them to those resources in our community that they need. And it's not just as simple as, okay, this person needs to go to recovery. It really is a discussion that's open with the person that comes in about what recovery looks like for them. And it's driven by what their needs are. So if the person comes in without housing, we can offer them a safe place to stay that night while they work through some options, whether it be transportation to CMH in the morning to help establish them with care, whether that be connection to share the warmth or a shelter in the area. And we partner with a lot of our communities resources to have an open-ended conversation with them about what resources are available in the county to help these patients. And so really the peers are not just recovery coaches, they're kind of experts and resources available in Lenawee County. The goal of the Engagement Center is to really reach those people that have nowhere to go and aren't really aware of what their treatment path looks like, and offer them some solutions, or like I said, just a safe place to stay. It's an opportunity for them to avoid going to the ER because they're in crisis. People can come to the Engagement Center. They don't have to be in recovery to come there. There is no fee for them coming there. They can come and enjoy a movie if they want to and relax, or they can get a warm meal. We also have laundering services and a shower there if that's what they need. And so the goal is to really reach those people that are in crisis, that are struggling with substance use disorder. As you can see on our hours there, we're open every day, 7 days a week, midnight to 8, and over the weekend, we're open 24 hours. We are currently working with ProMedica ER to kind of open some pathways of communication there for their patients that come in with overdose or substance use disorder, to kind of do soft handoffs for those patients, or even patients of ours that are maybe in need of a higher level of care during a crisis. And then we, would send them to ProMedica and give them a handoff as well. I think another resource that we have there, we do work with the drug and sobriety courts in Lenawee County, and we provide smart recovery twice a day, at least during the week. So at 7 a.m. and at 8 p.m. every evening. Smart Recovery is an evidence-based mutual aid group that is an hour and a half long. And it's led and facilitated by a peer recovery coach at Pathways. And we also work with the courts for those that are in the treatment courts to kind of build the support around them while they're in those treatment programs. We do offer the Smart Recovery in person during COVID with screening in a limited capacity. And then we also have Smart Recovery mutual aid meetings available on Zoom. And those links are on our LCMHA page. Next slide. We are also active in the community, LCMHA, with substance use disorder. We do a lot of our work through the Lenawee Substance Abuse Prevention Coalition. The coalition works to reduce substance use in our community by bringing awareness, education, and resources to our community. As a rural community, sometimes we have to get creative. And we've done a lot of work in this coalition over the last year. And one of the new things that we've done is kind of split the coalition into several work groups. As you can see here, each work group is targeted to combat a specific area of substance use disorder and the issues it brings to our community. And it really has worked out well because people that are really passion driven in certain areas have joined these groups. A lot of our community partners have joined these groups. One of the work groups is work with prescribers. And so that has been behavioral health, mental health, and medical prescribers in our area. Currently, they're working to reduce stigma, to provide education and resources, and hopefully expand access in our community with medical providers by introducing some best practice that is recommended by SAMHSA and the CDC for medication-assisted treatments, and hopefully expanding the amount of providers in Lenawee County that are able and willing to start that treatment modality. They also work on alternative methods of chronic pain management. So we do have some interesting insights there into what providers can do other than opiate prescribing and safe opiate prescribing as well. So I'm really excited to see what that work group brings to the coalition. We also have the crisis intervention group, which meets to kind of address first responders' perspective to the opiate crisis and how we can assist them either through resources or supports like working with pathways to be a kind of diversion for those that are struggling with substance use disorder, and a place for them to go to avoid incarceration. That work group is still currently working on meeting and new work plans and ways that we can kind of open communication between first responders and other community partners. I think next slide we'll kind of get in further into some of these groups. Yeah, the prevention and education work group is working on or has established the drug take back, which is April 24th, and that will be at ProMedica Hickman Hospital. It will be from 10 o'clock to 2. And not only are they kind of hosting this affair, they are also providing a lot of resources and education on why safe drug disposal is important, resources on how you can keep your prescriptions safe at home, and giving you options to take back and dispose of not only prescribed medicines, but over-the-counter medicines. They take sharps back during that, even veterinarian prescribed medicines for your pets. And it's a really great resource for our community. And there's also some outreach through other community partners for like WLEN for, providing more education about this particular event. So I'm excited to see how many people participate in that. Next slide. Another new feature is the mobile recovery clinic. Some of you may have seen it a few weeks ago, parked outside of the Lenawee County Courthouse. This has been a project worked on by the Access and Use Treatment Work Group. And the recovery mobile clinic is really great because one of the #1 cited barriers for people being able to access treatment and care is transportation. So what this group did is really looked at data about where are a lot of the overdoses occurring in Lenawee County. Interestingly, it was kind of in that downtown Maumee Street area. And so we wanted to provide an access point for care in that area. Our initial stop was the courthouse because we do have the sobriety court and drug treatment courts there. So we partnered with the probation officers and the judges talking about how can we utilize this mobile recovery clinic to not only engage patients in care and potentially refer them out to our Lenawee providers when appropriate, but also provide things like urine drug screening, urgent care needs like urine analysis, pregnancy testing, COVID testing. This provider in particular wants to be able to help with vaccine distribution. So there are a lot of really great things that this mobile recovery unit can do. Its first day, it was only there 2.5 hours, and it had some really great response from the community. At one point, I hear there was a line outside of it. And all of the treatment court professionals that reached out to me had nothing but really positive things to say about this unit. And moving forward, the plan will be that it comes bi-weekly in April, starting in April, and we'll be there at approximately 6 hours at a time. I think roughly from 9 o'clock till 2 was what the suggestion was. And then really this group is going to look at how that is received in the community, what the capacity of this mobile unit is, and then really look at the data again to see where else it's needed in our community. So I think that's really exciting, but that's come to us. Next slide. The jail reentry program, we've actually had that developed for a little over a year now. This is a great passion of mine because one of the highest times or the highest risk for overdose in an individual's life is when they are released from jail or prison. One of those reasons is because they're forced into abstinence without any real treatment. And so when they get out, their risk for overdose is actually like 70 times higher than a normal individual. And even a year later, it's still like 12 to 15% higher than just a normal average citizen. So it's definitely an issue that I'm excited for this jail reentry program to address. Obviously, this program's been a little hampered by COVID. It's kind of reduced our ability to get into the jail. But what's really great about it is it really wraps the person being released in care. Individuals are screened in the jail for substance use disorder by one of the Cmh providers. And if they're positive for that screen and they're receptive to MAT treatment, which would be Vivitrol, which is a complete agonist for opiates and alcohol, then the individual, the inmate, will actually receive their first dose of Vivitrol while in jail. And they will also be connected to a peer from Pathways Engagement Center. And then that peer will give them a little bit of education about recovery, what it's going to look like when they're released, help them facilitate transportation, and all those kind of immediate needs that an inmate will face when they're released. And then also provides transportation on their first day of release to all of the providers that they're going to be working with. So their medical provider, their substance use provider in the community, as well as their substance use provider peer. So that engagement center peer will walk them through to all of their permanent care providers. When that happens, there really is an increased rate of someone sustaining abstinence or sustaining at least treatment, and really impacts the reduction in recidivism, continued use of substance, and continued criminal behavior. So the impact can be really large for Lenawee County. It's a really exciting program. And I'm hoping that once we get more access to the jail, we'll see more inmates taking advantage of it. Next slide. And now I'm going to pass it off for Jackie Bradley's end of the presentation for the Lenawee Collective Impact Corps.
All right, thank you, Kelly, and good evening, everyone. So the other part of a lot of our community work happens through a group called the Collective Impact Corps. And collective impact is basically just a way for groups of people to work together to solve complex problems. It's just a specific way to format our work together. And in Lenawee County, the Collective Impact Corps is the champions of that model. And CMH acts as the backbone support organization. So that means that we provide staff time, organizational support, kind of whatever this group needs to keep the work moving forward. One of the components of successful collective impact is a common agenda. So that's a shared vision for change that includes a shared understanding of the problem and a joint approach to solving it. And in 2014, the Collective Impact Corps identified trauma as their common agenda item. And that is because research shows that traumatic experiences have a significant impact on individuals. The landmark study in this field is from the 1990s, and researchers at that time linked 10 specific adverse childhood experiences, or sometimes called the ACEs, if anyone's heard of the ACEs study, to future life outcomes. So basically, the more ACEs someone had, the more negative outcome they had. And we do see that that trend holds true very much so here in Lenawee County. So from the 2017 Community Health Assessment, we saw that an adult with a history of traumatic childhood experiences was 450% more likely to have used recreational drugs in the past 6 months. And so it held true across a lot of negative life outcomes, all of which you see on the slide here. So once we understand the impact of trauma, then we need to figure out how to respond to it. And one of the ways to do that is to practice trauma-informed care. And this is a model that really emphasizes the physical, psychological, and emotional safety of both providers of care and survivors of trauma. And trauma-informed care also recognizes that those are often the same people. And how do we embrace that and really respond to that among our staff and our consumers? And that sounds really great, but we also recognize that it is a process. We don't just jump from kind of business as usual all the way into being trauma informed. Both individuals and organizations will move from trauma aware to trauma sensitive, trauma responsive, and trauma informed. Over time, they will move back and forth along this continuum, and it will change as their knowledge and their practices change. And then the last part of our presentation here is going to be a bit of a switch gears to discuss some of the key findings from the recent report that we worked with on with public sector consultants to get a little bit of more information about the access to crisis services in Lenawee County. And so one important thing to note about this report is that the data only includes Medicaid beneficiaries. So we do believe, and the data shows, that these results are applicable to the community at large, but the general population is not going to be included in these numbers. So the key findings of the report are that the number of Lenawee County residents receiving care in neighboring counties emergency departments and inpatient units has increased in recent years. Receiving care in low. And finally, there's an unmet need for behavioral health services among Lenawee County residents.
Jackie, I think you're cutting out.
Can you hear me at all?
We can now, but you're cutting in and out a little bit.
Sometimes if you turn your video off and just use your audio, that helps.
If I turn off my video, is that any better?
I think so.
Okay. I will try to keep going. If you can't hear me, please just stop me.
We could hear that.
Okay, perfect. So the next couple of slides will be showing some of the data that supports these findings. All right, so this is just the prevalence of mental health conditions in Lenawee County. So we know that about 25% of people in Lenawee County have a diagnosed mental health condition. And for substance use disorder, that number is about 6%. So about 6% of the county has a diagnosed substance use disorder. Visits to the emergency department. So from 2016 to 2018, the number of people visiting a Lenawee County emergency department decreased by about 32%. And during that same time, we did see an increase in our surrounding counties. So this suggests that for a variety of reasons, people started going elsewhere to seek their emergency care. And this is specifically health care. It does include emergency department visits. And the similar data regarding inpatient admissions. So the same time period, 2016 and 2018, the number of people getting inpatient care decreased by about 35% and increased in surrounding counties. And so some might be wondering why there were inpatient and those 5% of people who were still receiving inpatient behavioral health care are most likely people admitted to that physical health side of care. So that might be something like medical assisted detox or something along those lines. So that is still a behavioral health care service, and so it is included in these numbers. And then as far as unmet need goes, we know that over half of the people in Lenawee County with a diagnosed mental health condition were either untreated or undertreated. And when we start looking at people with substance use disorder diagnoses, it's over 80% either did not receive any treatment or did not receive the full amount of treatment that they needed. So this shows that there is definitely a need for the services that we provide and plenty of expansion of those services. And then the final thing I have here is just a third change of direction and a quick plug for the Erase Stigma event. I know that's usually in the spring, but it will be on Sunday, September 26th this year. So mark your calendars.
And I will jump on just to say one of the things that's really important to us at CMH is figuring out a way to reduce stigma. Receiving services for mental illness and even more so for needing help for substance abuse has such a stigma attached to it. That's the primary reason people don't seek help. And so our goal in educating the community, whenever we can do a presentation, and especially when we can include our peers who will tell their stories and our recovery coaches, is to start to reduce that stigma and to really encourage help seeking. The sooner people get the help they need, the less likely they're going to need our help, which I probably shouldn't be promoting, right? But honestly, the sooner people get into the help that they need, the less trauma they're going to experience and just a better life that they're going to have. So we definitely appreciate being invited tonight to be able to talk with you, and wanted to make sure we left some time for questions.
Commissioner Harvat.
Okay, well, thank you so very much to each and every one of you. There's a wealth of information. I have some questions that were submitted a bit earlier that I would like to just bring up, and then we'll open it up. I think, first of all, how would a family know of the, like, for instance, the Pathways engagement? How are people aware of these services? Like, for instance, the Mobile piece, how would someone know that was available by the courthouse last week. Do you have flyers? Do you go on the radio? Just how would an average person know that's available for a family member, let's say, that I would have that would like to access those services?
We do have flyers. We are on WLEN. I feel like all the time. It seems like every time I turn on WLEN, I'm hearing something about us, but maybe other people are turning on at different times. We do advertise at the movie theater. We tried the gas station TV. I don't know how effective that was. We also put information in the paper. We have a Facebook page. There are some resource cards out there that identify us. Anyone that goes to 211 should be able to find all of our services and a lot of the community services. The mobile unit is really brand new, and I don't think they've settled on a day yet. So that would probably be more word of mouth right at this moment, but they're putting together all sorts of advertising, marketing kinds of materials too.
Very good.
And then when we have the opportunity to speak at a group that includes people that don't normally show up to meetings with us or come and get our services, we absolutely welcome that opportunity.
Very good. And the other question would be, in light of everything you've talked about this evening, where does your personnel come from? Where do these workers come from? Is it basically Lenawee County? Do they live here in the city? Are they volunteers?
Most of our staff live in Lenawee County. Some of us travel from out of county, like me. I can tell you that in the behavioral health system overall, not just the public system, there is a tremendous shortage in our workforce. It is very hard to find social workers and nurses and case managers and even recovery coaches and peer support. So, we look wherever we can to bring in just the best quality of staff that we can find.
Oh, right. And do you have Spanish speaking counselors, or does the Hispanic community have access to people that they could speak to in Spanish?
Yes, we have a contract for interpreters, but we also contract with an agency that does Spanish speaking therapy. And we have a couple staff that speak Spanish. Certainly we need to invite that community in more. They're certainly underserved, and for a lot of reasons.
Right.
May I ask a question?
Sure.
This is Idali Feliciano. I'm a community member. So how do you communicate presently with the Hispanic community about all the services you have? Do you use the Hispanic radio program? Do you use other community organizations and groups like the Guadalupe Society or the Migrant Resource Center? Because I haven't seen anything. I haven't heard anything in Spanish.
We've had some commercials on WLEN during the Spanish speaking programming. But I'm very open to whatever ideas you have, anybody on here that we can get the word out. We certainly don't have all the answers, obviously. And so I would love to hear some of your suggestions.
I will be glad to get in touch with you.
That would be great. And maybe you could help us get connected, since you know people and they know you. A lot of times it's about trust.
Especially about trust among Hispanic individuals.
Yeah.
And so we need an introduction.
Okay.
Yeah. Yeah, Italy would be a great resource for you.
Right.
And to move into the churches too, the pastors and so on, to get an opportunity to visit those churches and do a little presentation, or, be around for coffee and donuts or something like that, to just introduce yourselves and say what the services would be. It'll be one way to develop a little bit of trust. And then if you have your pastors supporting you, who the people do trust, would be very meaningful. You know.
I think that's a great idea. And part of the reason I was excited to come to this meeting tonight is to meet people who can help us get connected to the community leaders that our members trust.
Mhm.
I think that's a great idea.
Yeah, it'd be wonderful. And then,
Sister
go ahead.
Pat is also bilingual.
Oh, yeah, but we're like in quarantine. I was going to say the sisters are a great resource once we get out of here, because they know a lot of people, you know, and they know how to make connections. We have, you know, our justice promoter is on here, Sister Kathy Nolan, and she's a great resource person to move into those areas also.
Great.
Yeah. And then one last question. I know we had a town hall earlier in the year about policing in here in Adrian. You know, we had the police officers on and chief of police. We just were curious, do you offer any training for the police, or you know, they said that's the primary problem they have is taking care of the mentally ill, and they're not equipped to really do that when they, you know, have to engage in an encounter with someone mentally ill. Do you provide any training, or would you ever think of doing something like that short term for officials like that in the government that work for us?
Sure, we have done trainings for law enforcement in the past, and we're always open to doing that. And Chief Emmerich and several other chiefs have put together a group to really look at how do we work together to provide whatever is necessary to help law enforcement in dealing with people who have substance use or mental health issues. We've only met a couple of times, and then of course COVID has impacted everything we're doing, but we are all committed to continuing to explore that. And then we do have the other committee that's meeting that's looking at access to crisis services. And we've had the sheriff and a couple of the chiefs and EMS join that group to take a look at how do we provide a wider variety of crisis services to the community.
Wonderful.
We have to work together on it because none of us is big enough to take on the whole project.
Right.
Absolutely.
Yeah.
Absolutely.
Well, those were the questions I had that were submitted earlier on. So Commissioner Bernard, do you want to?
Yes. Thank you so much. We appreciate everything. At this time, we're going to allow the mayor to have words, and also she will open up for more questions and those that are on our town hall. Mayor Heath?
All right, we were losing you a little bit there, Commissioner Bernard, sorry.
Okay.
Thank you so much, Catherine, Holly, Kelly, and Jackie. It's so appreciated. One thing that I was actually waiting on, because I was actually I do meet with the pastors of our entire community once in a while, and I was supposed to do it a few weeks ago, and I actually put it off, waiting for this tonight to listen and hear everything that you had to say. And so one thing I would like to do is invite you the next time that I meet with them. I meet with them via Zoom, but the next time I meet with them, I'd love to invite you. It's during the lunch time. It's during the lunch hour in the middle of the week. But I would love for you to come and share, and listen to them and share your resources and, make that connection. And I can make sure that happens just to help expedite that. So I would love to do that. Yeah.
That would be great. Appreciate that.
Yes. One thing that I get people in my office pretty regularly that are very concerned in the community. So I guess I just wanted to clarify a point that they're telling, this is what I'm hearing, okay, whether it's substance abuse or whether it is some kind of a crisis mental health situation, that they're saying they're taking them to the hospitals and the hospital's saying, there's really nothing we can do. You know, we're not going to keep them, and they don't really give them resources. Now, if they are or aren't, I'm not going to take sides on that. I'm just telling you what I'm hearing from the community. And there's been concern, and these are coming from family members. Like, they're concerned that, you know, they didn't seem to, like, they were very concerned about a very bad substance abuse situation, and they felt like they were rejected by the medical, you know, system here. Also the same when it came to somebody with a mental illness, but they weren't suicidal, so they didn't keep them, and they let them go, but they were very concerned how they were going to be. So I'm just letting you know some of the concerns I'm hearing, and I don't know if they're just not connecting to know, and I didn't have you as that resource to connect them to as well, but I just not really sure how to make that connection, or what I can do, or what we can all do to spread that word.
So I think one of the things that's challenging in dealing with people who are struggling with any kind of disability in our system, it's absolutely voluntary. So the emergency room does have resource cards that they hand out to people, and they call CMH if somebody needs our services. They call us day and night when they have somebody in there that needs services. And especially for substance use, because we do manage that benefit for Medicaid and uninsured. But a person doesn't have to follow through on the appointment. And I think we see that happen more often. I can't answer for exactly what they're doing in the emergency room, except the interactions that they have with us. And they do contact us quite a bit. And we are working on a connection to a peer recovery coach for somebody who comes in because of substance use issues that probably doesn't really feel like they need treatment yet. So we can connect them with somebody who's been there and has lived experience. And they're really leading that effort with us.
I was screenshotting a lot of the slides as you were going through, because I thought they were very helpful and very informational. And I can't remember what it was one of the last slides, but where it showed that, you know, we had gone down a lot with inpatient and those even seeking help at, you know, medically. Do you think that's due to the fact, like, that we did lose Heritage, and we lost that back when we were still split between Bixby and Heritage? But Heritage, I know, used to have an inpatient treatment, and we lost that. Do you think that is the reasoning? I was just kind of curious if that is why we saw a decrease, and maybe why they were going elsewhere.
I believe that's probably why. We had to do a lot of messaging to the community that if you're in a mental health crisis, you still go to Bixby or Herrick Emergency Department. I think people were confused the closing of the inpatient with access to care. And you can go to your nearest emergency department, no matter where you are, and get screened for inpatient. And so that was a lot of messaging ProMedica and CMH had to do to help people get to care as soon as possible. And of course, that number's gone back up.
Right. Well, I, you know, just so thankful for this. I mean, this is great information, and anything that, you know, we can do as a Human Relations Commission, and, you know, me at the city level to just, you know, come alongside assisting. Let's get that word out there. Let's really help our community. And thank you so much for all the great work you're doing. It's very appreciated. And just to clarify, the Family Medical Center, I actually had to look it up, because I was like, where is that? So I was actually looking it up while you were talking. I'm like, I've seen it, but I don't know where it's at. That is the one that's just past the skate park, past the new Taco Bell on North Main, just so that everybody knows, because I actually had to look it up on a map, because I couldn't think. I knew I had seen it, but I couldn't remember where it was. You know, but, you know, to help get that word out as well, so people know how to access those resources.
Absolutely.
So at this time, I would love to open it up, though, for the public to ask questions. Just, you know, chime in, and if there's a couple of you, just wait your turn and we'll get all your questions in. We have a very quiet group tonight, I guess.
Yeah.
It's a lot of information. We can share that PowerPoint too, if that would be helpful.
Yes.
And we're recording it, and this will be, so we do have it recorded as well, so that we can share this recording as well.
Okay, great.
But yes, but to share the PowerPoint with us would also be amazing. I
We
mean,
can do-
I'm not going to lie to you. I have an autistic son, and I didn't even know about I learned a lot tonight, and I'm actually involved a little bit in this and should know a little bit more just from all the services I've gone through. I mean, he's an adult now, but I actually, myself, it was just a lot of information. That's why I was like screenshotting as fast as I could to try to get every slide, because I just thought it was very helpful. But I mean, it was a lot of information that I wasn't even aware of.
Yeah, we'll add a slide with our names and our main contact number. Especially because there are a number of people here at this meeting that are going to help us get connected with other community leaders. And also just to remind you that there's a lot of work that's happening through our collective impact work, addressing things like essential needs, community health, financial stability, housing, all those sort of things. So if you have a passion in any of those areas, definitely get a hold of Jackie, because she can connect you to a group that's really, we have several groups out there doing a lot of work.
If we went, is there like if we went to like the website though, are you listed on there if we were trying to locate you? Is everybody listed on there on the LCMHA website?
I know I'm on there because I have to be, and I
So
can
if-
definitely direct you to anybody else.
If somebody reached out to you, you could direct them to the right person? Okay.
Yes, yes. But like I said, we'll include our contact information on a slide when we send the PowerPoint.
So how often are we going to have that mobile recovery? I mean, I know that we had it that once. Do you have any idea yet on that? I mean, that just sounds like an invaluable resource for our community right now and so needed. And I was very excited. I actually did see that. I was driving by, I was driving that way, but I feel like that is definitely a resource that's very needed right now in our community for sure.
That's a Kelly thing.
So right now they're looking at bi-weekly starting in April. And I think that starting April 8th, hold on a second.
Oh, I think she's freezing up, but they are going to try to come twice a month starting in April. Is that right, Kelly?
Twice a month starting in April 8th.
Awesome.
So, and that'll be from 9 to 2. Yeah, 9 to 2. And really the goal is as this provider starts coming to Lenawee County, we do have a lot of her resources. We were just kind of looking for a more solid schedule for her before we really pump those out into the community.
Well, I think that is amazing and great. And I'm very excited by that, especially. I just know that there are people that it may be due to COVID, but it just maybe they don't feel comfortable going into an office, or they've had a bad experience in the past. I've heard that as well. And this provides them an opportunity that they might jump at this just because it doesn't feel as invasive. It doesn't feel as scary possibly, or whatever, it just is more comforting. So I really appreciate that. Thank you.
Yeah, and I know the group is particularly, it's just interesting looking at churches too, like in some of those locations. I know some ProMedica members of the group have relationships with some local churches that there are discussions about where the next site that we could park it at could be. So absolutely, if you have anyone interested, let us know.
Good idea.
How often are you planning to have that mobile vehicle on the east side of town, say on East Maumee or near the post office, or in the neighborhood, where the food pantries are and the meals? I think you need to be very, very close to where people are congregating, because I wouldn't see people wanting to be very close to the police department, the jail, or the courthouse. So that location to me does not seem to be conducive to developing trust and people wanting to come.
Yeah, for sure. That was one of the factors. Everything you said is being considered. We did take that thought, and we were trying to be a resource for the treatment court because we weren't sure what the response was going to be. And I think it's pretty evident to everyone's kind of interest in this unit, like what the big need for this kind of like resource is. So I hear all of you, it's brand new. I'm just as excited as you are about it. And
Yes.
for sure we'll get more information out. It's great to hear everyone's interest.
And that's an independent provider. She doesn't work for us. It's going to be kind of negotiated with the community group that's meeting.
Okay.
Do you have a hotline where folks, if they don't speak English, can call for help?
Our crisis line?
Yes.
Yes.
Yes, we can get interpretation for them when they call.
Okay.
If the person on the phone doesn't speak Spanish or another language, they have language line and other access to interpreters.
I have a question. Can you hear me?
Yes, we can, Hope. Go ahead.
I got Spumoni here. Since we have so many colleges here, and if there was a young person who wanted to go into this career in the future, what would you suggest that they study in school or do as far as internships or degrees? What sort of education would you recommend for a young person who wants to help?
We have social work programs at the bachelor level here in Adrian, and so that's a great place to start. Psychology is a good place to start, and internships. We do internships at CMH, as do our community providers. So they could intern in a number of agencies to learn a little bit more about the program. And many of the agencies look for volunteers and mentors. Mentoring young people is another good way to get some experience in working with our population.
Are there any other questions?
Well, I had one question I don't think we talked about, and that is we touched on, and that was a homeless. How many of the homeless individuals have you been in Lenawee County or Adrian area have you been dealing with? And what would you say would be the major issues that we have to deal with in this community, or the police have to deal with, or is something that we can do to assist in that area?
So I couldn't tell you how many of our consumers are homeless or have been homeless. Probably a decent number of them have been. Some, when I look at what our essential needs coalition is working on, we see a lot of food insecurity. Transportation is always an issue. Access to financial resources to manage utilities and those sort of things. Those are some of the things that we're seeing. And then really just getting people into the services that they need.
Okay. Well, Mayor, do you have any more? Anything else
Nope,
you'd like to?
Not hearing anymore. I will turn it back over to you, Commissioner Bernard.
Okay. We'd just like to say thank you so very much for all of you being a part of this first mental health discussion forum. And we just appreciate all of you and your input, especially those that have asked questions. And if you have any other questions, if you would forward them to me, the mayor, or Commissioner Pat Harvett, she's been working on it diligently with them. And we will forward those questions to you, Catherine, if that's fine with you.
It is.
And also, we'd like to thank your staff for such a wonderful presentation. Their expertise, it really makes us to understand how vast your job is, your responsibilities are for us in this county. But we are definitely interested in knowing more. And if you publicize things, we would like you to get in touch with us and let us know about what you're doing. You can do it through my email. Also, the mayor and Michelle is on with us. And so the city can at least steer us in a direction where we can get information. I'm extremely excited about the mobile unit, because we're talking about a mobile unit for different things in this community that may be much more advantageous because of the transportation problem that people are having. So maybe we can just give you some suggestions on the locations, and if the mayor, when she meets with the pastors again, they may volunteer, because there's some outside the city where cars can come in and meet and not have a problem getting in and out. We also have a space in the city, because I know most of the pastors are ready and willing to assist in any way that they can. So again, we'd like to say thank you so much for everybody attending. We're not going to keep it going. We're just going to thank you all. And I really appreciate Catherine for your guidance, and you did an excellent job, and we applaud you. I know you can't hear me applauding, but I'm applauding you for such a wonderful presentation that you did. And we're going to look forward to possibly having another one. And maybe not having it all mental health, but it is always a part of most of what we are trying to get accomplished. So thank you, thank you, thank you. And at this time, I will close the meeting out, and I'll ask for us to say goodbye. Thank you so much for being with us. All right, you all be good. Stay safe.
Thank you.
You need to, all right?
Catherine, I'll be in touch with you, okay?
Mrs.
All
Bernard.
right.
Great, thank you.
Thank you.
Thank
Thank
you
you,
so
my
much.
friends.
Hey, Mrs. Bernard.
Yes.
I was just going to say, I didn't have questions, but I just wanted to say we have someone from Lenawee County. My daughter is here in Arizona, but she's the Chief Behavioral Health Administrator for
Wow.
mental health.
We'd love to have her come on.
Yeah.
Arizona.
Okay, so what I'm going to do is work with you to try to schedule her for one of our pre-meetings. And so we can get her to do a presentation for us. All right. And thank you so much for being with us from Arizona.
Yes.
Okay. All right. Thank you.
Thank you.
Lots of
Thank you.
information. Yeah.
Yes, lots of it. Okay. Goodbye, everyone.
Bye, Andrea. Bye-bye.
Bye-bye.